Hi, my name is Jessica Taylor. I've been a facilitator with Cancer Support Community of Greater St. Louis since 2013. And in this presentation, I am going to talk about supports for caregivers in a presentation called Push the Pause Button. So first, we wouldn't be doing a good job with a presentation called Push the Pause Button if we didn't take moments throughout to push pause. I'd like to take just a few minutes for you to think privately about a specific time when caregiving felt difficult to manage. It could be a recent event or something from the past. How did you react? What did you notice physically or emotionally during that experience? So if you want to pause the recording for a second and think on that, and then after you've had a few moments to think on that, replay the presentation. Okay, so now let's imagine that instead of however we actually reacted, we decided to pause, to just pause. Stillness can allow us to gain clarity and manage our thoughts, feelings, and behaviors before reacting. So throughout these slides, I'm going to encourage you to spend some time thinking about some of the challenges you might face when a loved one has cancer and some tips to help, in a sense, push pause in the moment when we need it most. So here's an overview of the topics I'm going to be talking about. And then, of course, you're always welcome to contact CSC. And if you need additional support, want to talk to someone, this is meant to sort of try to give you some thoughts, some ideas, help you process. And of course, you can reach out to CSC if you want some additional assistance and support with processing these topics. But so the sorts of things I'm going to talk about in the slides are things like becoming a caregiver, common worries and concerns, mental health and cancer, role changes, benefits of caregiving, balancing caregiving and work, emotional well-being, and then finally pushing pause. There's a quote that is something to start kind of thinking about. So Rosalind Carter said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And so thinking about that, how would you say that you identify? Are you only one of those categories as a caregiver? Do you see yourself as a caretaker, a carer, or maybe a co-survivor? So some of this is also figuring out the language that resonates for you in your identity as someone who is giving care to someone. So who are caregivers? So, and I am going to read right off the slide. Cancer caregivers have diverse backgrounds and characteristics. Cancer caregivers tend to be women, around 58%, and most have less than a college degree, around 60%. They tend to be about 53 years old on average, which is about 4 years older than non-cancer caregivers. Most cancer caregivers provide care to a relative, about 88%. 6 out of 10 cancer caregivers provide care to someone age 65 or older. And this information comes from a national study on caregiving. So becoming a caregiver. The ripples of a cancer diagnosis extend to spouses, partners, siblings, children, and friends. Many of these family members will find they now need to take on the role of a caregiver, something they've never done before. So your main job as a caregiver will be to support and encourage your loved one as they learn about their cancer and make decisions about and then start their cancer treatments. And what will this involve? Well, not all caregivers do all the same things. But as you'll see on the slides, as found in CSC's National Cancer Experience Registry study, a number of findings were found. And a few selected findings are that 98% of caregivers provided emotional support, 96% went with their loved one to medical appointments, 82% helped with decision-making, 79% coordinated medical care, 80% provided transportation, and 74% helped manage finances. You can see there's a lot of stuff going on for caregivers, as you can probably relate to. And so common worries of being a caregiver. So on the screen, I want to ask, do any of these reported common worries resonate with you as a caregiver? And this might be a moment to pause and read and reflect on the topics and see how they have affected you, or do you have concerns about them affecting you? So common worries can be being thrust into a caregiving role unexpectedly with little preparation, perhaps performing caregiver tasks alone, maybe fear of losing someone you love, juggling caregiving duties with other daily activities, and perhaps feelings of inadequacy. You may have experienced some of these, and these are very common concerns and worries as caregivers. So top concerns. While we may not wish to acknowledge it, uncertainty is a natural and unavoidable part of life. Very little about our lives is constant or totally certain. Life can change very quickly and very unpredictably. Our Research and Training Institute conducted a cancer experience registry survey for caregivers. Of those caregivers that responded to the survey, 71% expressed worry about their loved one's cancer progressing or coming back, and 67% expressed worry about the future and what lies ahead. And these were the top concerns that were reported by caregivers. The study found a number of other top concerns, and so the next few slides are going to be going over a number of top concerns in a number of different categories. So the top concerns among caregiver participants. So top 71%, the patient's cancer progressing or coming back or recurring. At 67%, worrying about the future and what lies ahead. So those were on the previous two slides. Top third concern at 60%, the patient's pain or physical discomfort. Tied at fourth at 59%, the patient's eating and nutrition and changes in the patient's mood or behavior. Next at 56%, exercising and being physically active. Next at 55%, eating and nutrition. Followed by the last three concerns at 53%. The first, balancing caregiving with other demands, the patient's sleep problems, and keeping up with my own healthcare needs. So the next slides are going to be breaking down a number of these different categories and talking more about key findings within each category. So let's talk about the top concerns of caregiver roles. So caregiver roles, 89% of those in caregiver roles were quite a bit or very much involved in providing emotional support, with 80% saying they were quite a bit or very much involved in going to medical appointments with the patient. 20% spent more than 100 hours per week caregiving. That's a lot of time in addition to what you might have in your own life. 16% reported having received formal caregiving treatment or training, and 41% of those trained wanted additional training. Top concerns of treatment decision-making. So 39% of respondents reported that making decisions together with the patient. So that's the idea of, as the patient is trying to make decisions, those in caregiving roles may be co-helping with making those decisions. And that can carry a lot of weight. That's a really important role to be involved with. 2 out of 3 said they were quite a bit or very much involved in patients' treatment decisions. And 29% reported that patients make decisions after considering their opinion. That's a big responsibility to think that your thoughts, your opinions might be influencing the treatment that someone else considers and pursues. That can take a heavy toll on us. So this slide is talking about top concerns of being prepared as a caregiver. So more than 1 out of 2 individuals felt at least pretty well prepared to respond to and handle patient emergencies, which is about 60% of those responding, and care for physical needs, about 58% of those responding. 58% did not feel prepared to care for patients' emotional needs. And 68% did not feel prepared to handle caregiving stress. Next is going to be top concerns of quality of life and distress for caregivers. So 49% reported substantially worse anxiety than the national average. About 34% of individuals reported substantially worse fatigue than the national average. And about 39% said their health was somewhat or much worse than before they began their caregiver role. So there is evidence to support that those who are put into cancer caregiving roles are perceiving challenges with their own quality of life and distress as related to things like their anxiety, their fatigue, and their overall health. Next, top concerns of caregiver needs. So what do caregivers say that they need? So about 3 out of 4 respondents wanted help with understanding the patient's medical condition and treatment. So if we think back, if those in caregiver roles are participating not just in treatment decision-making with the patient, but their thoughts and opinions are influencing the patient's treatment decisions, then it would make sense that caregivers would want help with understanding the medical conditions and the possibilities of treatments to better serve as a sounding board and help the patient as they navigate those treatment decisions. More than 1 out of 2 respondents wanted help managing health benefits and financial services. And nearly 1 out of 2 reported at least sometimes experiencing a sense of loss of control over their own life. So cancer can affect many areas of our lives. So the next few slides are going to focus on 3 primary areas that can be greatly impacted as a caregiver. And those areas are role changes, emotional well-being, and mental health and cancer. So role changes. Of particular note, 78% of primary caregivers perform health-related duties for the care recipient, compared to only 47% of non-primary caregivers. Similarly, primary caregivers, about 59%, are twice as likely to perform medical-related duties as non-primary caregivers, about 28%. More than half of primary caregivers, about 53%, pay bills and manage finances for the care recipient, compared to only 23% of non-primary caregivers. Among all caregivers, providing companionship requires the most time, with a median of about 33 hours a week reported. Primary caregivers, about 50 hours at the median, spend more than 3 times the amount of time on this role than non-primary caregivers, with about 16 hours median. Meal preparation is the second most time-consuming activity among all caregivers at about 20 hours median, a finding which is higher among primary, about 21 hours median, compared to non-primary, about 9 hours median for non-primary caregivers. So we can see from all those stats, caregiving encompasses a variety of duties, very multidimensional in nature, and can be quite time-consuming. And so lots of things that caregivers do. Caregivers do physical caregiving, they do practical caregiving, and they do emotional caregiving. So let's think about examples of what those all are. So physical caregiving, practical, emotional, they might be separate. Sometimes they intersect and all interplay. So caregivers become the patient health care team liaison. They help coordinate care. They become someone's personal shopper. They provide physical care. They offer emotional support. They provide companionship. They become someone's driver. They may become someone's housekeeper. They may order and pick up medications. They may handle practical and financial matters. They may become an insurance advocate. And we all know how time-consuming it can be to be advocating with someone's insurance to get medical procedures and treatments covered and paid for, and be checking each EOB and checking everything off. And we know how time-consuming that can become. And other duties as assigned. So if you think of this sort of reads like a job description, but it ends with that, that line we all love of other duties as assigned, to mean that we never know exactly what all is going to be involved. As a caregiver, you're there to help your loved one, the patient, with whatever they may need, whatever that might be. And that's a lot to have to do, and it can take a heavy toll on us. Let's also think about caregiving resistance. So as a caregiver, you want to understand and acknowledge someone's loss of independence being difficult, someone's loss of control being difficult, and change and uncertainty being difficult. So we can acknowledge that these are normal. And as a caregiver, it can be difficult to try to navigate and attend to all the tasks on the previous slide that I said sort of read like a job description, while you're also dealing with very human emotions and concerns about losing independence and control and dealing with change and dealing with uncertainty. So it can be a very stressful environment to be trying to do all those tasks in, as well as having emotional concerns to work with. Now, caregiving benefits. So everything up until this point has been how caregiving can be stressful and the things involved. And we want to make sure that we're acknowledging there are perceived benefits to caregiving, or we wouldn't do it. And so people can become caregivers for a variety of reasons, including a desire to care for their loved one, having a close relationship to the care recipient, having the time and capacity to do so, and living in close proximity to the care recipient. So some of these or many of these might sound like part of the reasons that you yourself are involved in caregiving. And there are going to be aspects of it that are not negative. You might feel that sense of purpose and pride. You might enjoy the role. You might be inspired as an advocate. You might have that, intrinsic fire that goes with advocating for a loved one to try to get them the care that they need. And that can feel like you're doing a lot of good for someone who otherwise might not have the ability or the energy or the concentration to do it. So there can be a lot of benefits to caregiving. We want to make sure to acknowledge this. So additionally, we want to think about caregiving and work and in terms of trying to balance those two things. And so 26% of employed caregivers have reduced their hours or job responsibilities, including 30% of primary and 16% of non-primary caregivers. About 18% of employee caregivers said they had taken a leave of absence, primary caregivers being more likely to have done so than non-primary caregivers. 14% of employed caregivers have retired early or quit their job, and primary caregivers are somewhat more likely to have done so than non-primary caregivers. And so when we're balancing caregiving and work, a number of caregivers, over half that responded in the CSC survey, over half were employed. So all these tasks and things to be done that we've discussed are being done by folks who are also trying to work jobs. And so that can also add to some of the stress and just the complexity of trying to be a caregiver. And so there's a lot of things to think about and make choices about. One being, do you inform your employer? How do you inform your employer? And to know your legal rights surrounding things related to having to take time off to care for a loved one who is sick. Getting help and support to understand what you are able to do, how to do it, so that you're able to not just provide the best caregiving that you can, but you're also taking care of yourself. So this is going to be another moment that you might pause and reflect on who did you tell at work when you first became a caregiver, or as treatment progressed or changed or recurrences happened. How have you gone about navigating working with an employer to let them know what's going on and to try to get the assistance and the support that you need in order to provide caregiving? So who did you tell? How did they respond? So if you want to just take a moment to pause and think about that, and then after you've thought about that, restart the video. So that was caregiver roles that we just talked about. The second area we're going to talk about next is emotional well-being. And so this is going to be another time when I'm going to want you to sort of sit and reflect. What are you the most worried about? Are you worried about the patient's cancer progressing or returning, exercise and nutrition, the future and what lies ahead, the patient's pain level, the patient's mood and behavior? Maybe all of those things. there can be a lot that you're worried about. And there are many what ifs when it comes to living with or supporting a loved one with cancer. And acknowledging the unknowns of cancer may make you feel anxious, angry, sad, or afraid. These are all what ifs that your caregiver likely is thinking about and talking about, and you might have those same concerns. And you might be feeling a lot of emotions related to those concerns. And how do you navigate those feelings while being a caregiver and providing support? That can be difficult to navigate. And so in this figure, it's showing emotional stress of caregiving. And it's showing differences of the studies cited over on the left side of the screen here, cancer caregiving in the US. And it's showing that those who are cancer caregivers, over 50% report perceiving being highly emotionally stressed from caregiving. And that being significantly different, a different value than those who are non-cancer caregivers, with 37% of them being perceiving that they are highly stressed. So not to minimize anyone's emotional stress related to being a cancer caregiver or a non-cancer caregiver, but validating that if you are experiencing what you would consider to be high levels of emotional stress related to caregiving and your role as a caregiver, that you're not alone and it's valid. And it is absolutely something that you deserve to be supported in and receive support with. And Cancer Support Community does offer support services just for those who are caregivers, to provide caregivers with a space to process those emotional feelings with others who understand as fellow caregivers and can understand, not judge, not shame, just hear and understand. And so I really feel like this slide paints a picture that if you're experiencing some emotional stress, please know you're not alone. And please know that Cancer Support Community recognizes that stress is being valid and is there to provide support for you as a caregiver. And so the final area we're going to talk about in these slides is about mental health in cancer. So with mental health, this can include things like distress, anxiety, and depression. And I'm going to talk about each of these ideas briefly before discussing what can be done to alleviate them. So the definition of distress, which we're going to start with, is extreme anxiety, sorrow, or pain. Typically, the common medical vital signs are temperature, pulse rate, respiration rate, blood pressure, and pain. Distress can be thought of as an additional and equally important sixth vital sign. Research has shown that patients and caregivers exhibit dyadic interdependence, which suggests that a patient's well-being directly impacts a caregiver's well-being and vice versa. In a study of caregivers, most of the caregivers, 52%, spent more than 8 hours daily caring for the patient. They also frequently reported the occurrence of new psychosomatic disorders, with the most reported symptoms being sleep disruption at about 24%, headaches at about 20%, and a lack of energy at about 16%. High levels of anxiety and depression were demonstrated in nearly a quarter of the study subjects. In nearly half of the cases, a substantial increase in monthly family expenses and restriction of recreation activities were reported. The overall gravity of the medical situation was perceived as severe by 86% of the caregivers. And there are predictable distress points along the cancer kind of trajectory. So diagnosis, when you're at treatment decision-making, when it's time for scans, or when you're experiencing what is often referred to as scanxiety leading up to scans, and then cancer progression, just how is it progressing? And so stress can occur along all the points of the cancer trajectory. And there are certain points that are known as being especially more stressful for both the patient and the caregiver. And it can be helpful to be able to prepare the best you can when you know you're at those points or they're coming up. And so there's a lot of consequences of stress. So quality of life, sadness, worry, acute illness, chronic illness, social illness, weight gain, and sleep issues. Take a look at all these, think about those, and make a mental note if something on this list has been prominent for you, if you've really been wrestling with any of these. This would be important to note, and again, recognize that these are all common and valid. And if you're experiencing any of these, you deserve to receive support yourself and take care of yourself just as much as it's important for you and your caregiver role to be supporting whoever it is that you're supporting. So next with mental health, we're going to talk about anxiety. And so caregivers with anxiety can have physical and emotional symptoms. Emotionally, you may feel tense, worried, wary, agitated, or distracted. Physically, you may tremble, sweat, or shake. You may be short of breath, have a rapid heart rate, or feel like your heart is pounding in your chest. You may have an upset stomach, headaches, loss of appetite, nausea, or difficulty sleeping. Anxiety and fear are common reactions to a stressful life event like cancer. Extreme or prolonged anxiety can lead to a more serious anxiety disorder that can affect your ability to participate actively in your loved one's treatment or your daily home and work activity. And as you'll see here on the slide, 49% of caregivers reported anxiety levels substantially worse than the national average. So if you're experiencing anxiety, those feelings or those physical feelings, again, it is normal, it is valid, and you are worth getting support for that. The final mental health issue we're going to talk about is depression. And when talking about depression, CSC's reports showed that about 34% of caregivers reported fatigue and depression levels substantially worse than the national average. Symptoms of depression can include sleeping too much or not enough, lack of interest in activities you used to enjoy, or withdrawal from activities you used to enjoy. Some amount of anxiety and depression is to be expected under the circumstances, but be on the lookout for signs that it is affecting you too much. Extreme or prolonged anxiety and depression can affect your ability to participate actively in your loved one's treatment or your daily home and work activities. And so when we talk about depression, we want to differentiate between symptoms, signs of depression, and then severe worry and sadness. And this is a gray area. I can't give you specific definitions of what is what, but things to notice and contact your healthcare provider for referral to a trained psychologist or licensed mental health counselor if you notice that your worry or sadness is getting in the way of doing the things that you need and want to do, and or you are worrying or sad most of the day for most days of the week. And so if you notice these two things, please find someone that you can talk to. You can even speak with your own primary care physician. You can talk to a member of your loved one's oncology team. Let someone know that you might be struggling, you might be having some challenges. It is not unheard of. And again, you deserve to be supported and receive the same type of loving care that you are providing in your role as a caregiver. And so when trying to balance caring for yourself and a loved one with cancer, it's critical to know some tools to help combat the emotional, physical, and spiritual toll caregiving can have on your life by pushing the pause button, even for a brief moment or two in your day. So many examples. You can start a morning routine that is just for you. If this can even be 5 minutes to sip some coffee by yourself, but it is a moment for you. You can prioritize the day by writing down what is most important to accomplish for that day. You can reframe thoughts that don't necessarily mean we don't need to reframe it to be positive. So what I mean by that is you've probably heard of the whole, think positive and whatever. And so when I say reframe your thoughts, I'm not saying invalidate your thoughts to make them positive, but you can help to neutralize the intensity of a thought, which can help alleviate some of those increased feelings of distress. So example, you might be thinking, well, what if this treatment won't work for my loved one? We might reframe that to, while we don't know if it will work, we are doing everything we can to follow the treatment course, keep on top of appointments, and work with our oncology team. So you see in that example that you're not invalidating the seriousness of the situation. You're acknowledging the situation, and you're identifying what you are doing, what you have been doing, to illustrate you're doing the absolute best you can with what you have with that situation. And so it's not trying to say that the problem goes away, but it is helpful to reframe and remind ourselves what we are actively doing and able to do to try to control a very uncontrollable situation. So we might call a close friend, family member, clergy member, join support groups, or find peer mentoring opportunities to enhance social support. And cancer support community has lots of opportunities to be in a supportive environment, do activities with others who are in caregiving roles. There's a lot of opportunities to not feel so alone and do something for yourself. You might try mindfulness, and there are other resources out there for what mindfulness is, mindfulness exercises. If you're interested in pursuing them, cancer support community often will have mindfulness classes, workshops, activities. So if that's something that interests you or has always interested you, you can probably learn some more about that through cancer support community. And you can also try to change your scenery, which can be something as simple as walking into another room or stepping outside and doing those things when you notice distressing thoughts or feelings coming up. And so this can allow us to recenter and pause and just take a moment outside of the situation in which we're finding distressing, for whatever reason we might be finding it distressing, and change the environment around us. And sometimes changing the environment, what we see, how the air feels on our skin, all of those types of changes can just shift our energy a little bit for a moment and give us a pause to take a breath. And so this could be another opportunity to pause the video and reflect for a moment on what I'm about to ask, which is, how have you coped with feelings of uncertainty or worry in the past? And so you might pause, how have you coped in the past? And then once you thought about that, I'd like you to think of, how could these strategies that you've used before to cope with feelings of uncertainty or worry, how could they be modified to fit your current situation? And so just think about that for a moment, pause, and then restart the video, and we're going to talk about that. So pushing the pause button. So let's review. You now know what your most important guiding value is. You've thought about how you might be able to create a simple goal of incorporating at least 5 minutes of self-care a day, or 30 minutes about 3 times a week. You now have a list of pleasurable activities to choose from, and you just have to try one. And if it helps, great, do it again. If it doesn't help, no problem. Try a different one next time, maybe modify it. Don't write it off completely. You never know how changing one element of something might change the whole flavor of a coping strategy and make it resonate and work for you. So the next step is to set an intention and create a simple goal. And so you might want to make a list of pleasurable activities. And this kind of flow that we're about to go through on this slide can be helpful in the thought process, in setting an intention of what a goal might be. And so number one, you think about what is something I used to like to do. It may not have been a coping strategy for uncertainty before. It could just be just a general activity that you used to enjoy and brought you pleasure. Can I incorporate it back into my life? Would I need to do it differently in order to incorporate it in? And this is where you're encouraged to be creative. Life changes, life circumstances and situations change. We may not be able to do something we enjoyed exactly the same way we used to. That doesn't mean it's completely out of our grasp or our reach. We just might have to be creative and think of some other ways to get sort of the same outcome in an activity we enjoy. We want to think about what might get in the way. So we want to be proactive and try to think of what could be obstacles, what could be barriers to being able to do a chosen activity, and be proactive in thinking what might get in the way of me being able to do this pleasurable activity, and how will I overcome that obstacle? So know in advance how you're going to handle different things that might get in the way of being able to do something nice for yourself. And then finally, make a plan. So we make a plan, we make a goal, we try to set it, and just the simple act of making that plan is starting to set the intention to do it. And we know that if we don't set an intention to do something, we're not going to be as likely to do it. So things like multitasking, negative people, negative thoughts, negative situations, competing demands can all lead to caregiver burnout. When we use up all our energy without refilling our tank, it can leave us on empty. And these can be our depleters and our derailers. So in the previous slide, when we're thinking about an intention to make a plan, those are the sorts of things that might get in the way of us being able to carry out a well-intentioned plan to work toward a goal for ourselves. So we want to be thinking about different things that might be leading to caregiver burnout that might get in the way of us following through on an intention of a goal to do something nice for ourselves. So what can we do to refuel and replenish our tank as a caregiver? And so we're constantly needing to refuel and replenish. So it's not going to be a one-time thing. Sometimes the concept of self-care is described in such a way to suggest if you do something one time, you'll be fine. And it might be nice that one time, but what really builds an ongoing self-care practice is to really work it into a routine of some kind so that you are proactively making the space and the time to do these planned nice things for yourself. And that's what helps to refill your cup, replenish you on an ongoing basis. And so if an obstacle or a barrier comes up, it's not as likely to completely knock you off your plan. You just might have to modify your schedule or modify your plan. So it helps to make your self-care and taking care of yourself more of a routine than a one-time thing. And one example that you might look up on the internet, look at videos, there's something called loving kindness meditation, which is an approach to meditation. And it is a loving, kind way of thinking about yourself that will bring you a deeper connection to yourself. And so you can use mantra, repetition of words or phrases to elicit a relaxation response within yourself. And as we do that, we're able to choose love over fear and send that loving kindness to others. And so I encourage you, if any of that sounds interesting, look into it, look up some videos of it, and perhaps try to incorporate some loving kindness meditation into your routine as a self-care strategy and approach. So all this to say, there's really no right answer that will fit all people. The key is thinking about what works for you and committing to it. Maybe you put your value word on the bathroom mirror. Maybe you tape your list of pleasurable activities inside a kitchen cabinet. For each person, the changes made will be a personal one. And so as you see on the slide, you want to be thinking about making plans for the future and make changes that are important to you or your loved one. Perhaps start a new hobby or restart a previously loved hobby, and keep moving ahead one step at a time. And you want to set new goals and priorities. So perhaps those goals or priorities involve spending more time with family and friends, focusing on what really matters, completing a project, like something around the house, something with your photos, maybe a scrapbook, whatever it might be. But it's very much an active process with intention of making plans and setting goals and finding ways to achieve them one tiny little step at a time to keep yourself well as a caregiver. And reach out. It's also very helpful to have a list of trusted people you can reach out to, which might be friends, clergy persons, or mental health professionals. You can talk to your oncologist, your oncology nurse, or oncology social worker about your concerns. Some fears and concerns may be unfounded and can be cleared up through a better understanding of your loved one's cancer and its treatment. Sometimes we're worried about things we don't need to be worried about, and talking to someone can help ease that. And of course, since this is a recorded presentation, I'm not able to elicit time for questions and answers, but I encourage you to sit and think and reflect. And if you have any questions, write them down. And this could be a great opportunity if you haven't been involved with cancer support community for yourself, more as a support person for your loved one with cancer. This might be a good opportunity to have some questions that you could reach out to cancer support community about and talk to one of the people there and find out what opportunities and services and workshops or groups or classes might be available for you in your well-being as a caregiver. Because I want you to always keep in mind that your well-being is important. And your loved one who you are performing that important caregiving role for, it's important for them that you're taking the best care of yourself that you can. And so I hope this has been helpful, beneficial, gets you thinking, and we look forward to seeing you at Cancer Support Community.